One of the drugs found in Jackson's rented home after his death was Diprivan. Dr. Omar Manejwala treats people who are addicted to that, and he joins us this morning live in our studio. Good morning.
Morning.
How does that drug make people feel?
Well, that's a mystery to some people because mostly what Diprivan is for is to induce coma. So the idea is not to feel anything. Sometimes when people emerge from Diprivan, they do feel a sense of euphoria. And what happens with Diprivan addiction occasionally is people try to play with the doses and get the doses within a window before they induce coma.
Okay, so that's a typical usage of it. Who typically are the people who end up addicted to it?
Well, addiction is a treatable brain disease, and in some respects, anybody is susceptible.
Right.
But with this particular agent, the people who most commonly are addicted are healthcare professionals who have access to it.
Who have access to it.
Right. Yeah.
So they know about the experience of having used it. How difficult is it to get if you wanted to abuse it?
Well, I mean, that's depends on where people are. So up until a few years ago, it really wasn't controlled very much at all. Now some centers have begun to control access to Diprivan, but by and large, it's still not controlled the same way that medicines like fentanyl or more powerful addicted medicines
that are typically used in anesthesiology.
Correct.
Right.
Correct, yeah.
This is how rare is this? Because it's one of those things that I think until now people have almost never heard of.
Right.
You're just a handful of people in this country who actually deal with it as an addiction. How rare is it?
It's quite rare. Addiction is common. However, addiction to this particular agent is very rare. The exact incidence isn't known. There was an email survey that was done a few years ago to directors of anesthesiology programs, and it suspected that the incidence was approximately 1 in 1,000.
How difficult is it for your clients to come clean after being addicted to this? Is it more difficult to be rid of than, for instance, alcohol or some other kinds of things people abuse?
Well, I think the main message is that addiction is extremely treatable, and the outcomes for this agent aren't exactly known, but in my experience, they fall in line with treatment for other addictive disorders. So that is about 70 or 80% success rates. There was a study that was done by McClellan and Skipper that showed that of 904 physicians who were treated, followed for an average of about 7 years, they had about an 80% success rate.
So it is a treatable thing.
Very much so.
Back to the original question, and that's whole idea that the reason to use it is to almost feel comatose, or this notion of the euphoria when you come out of it.
Correct. That's the initial reason to use it. And once addiction develops, the use becomes compulsive. What we find for most people who use Diprivan is that there's a history of trauma or post-traumatic stress disorder. Not for everyone, but for most people who develop addiction to it. And what they're trying to do is blot out the experience of life in some way. And so life becomes so difficult for them that they use the Diprivan in order to magically disappear, if you will.
Wow. Dr. Omar Manejwala, thank you very much for your information.
You're quite welcome.
Do appreciate it.